So what happens if you don't want the patients to see it? How do you put it on the record? Or how does it?
Right. Well, let's think of the examples, because then you'll know what I'm talking about here. What do we do with child protection meetings, where it clearly states this is only for the GP to be seen in bright red and nobody else is allowed to see it? What about letters that may have third-party data in them, where the consultants have clearly stated we do not want this to be shared with the patient? First of all, the question is, does that consultant know that we're actually offering records access? In our practice, what we've done now is whenever any letters are sent out to any hospital, any clinician outside the practice, on the bottom in the footnote it says, it has a big warning sign saying we are offering records access. This allows patients to see all letters that come into the practice. If you have any concerns, please contact Dr. Hannon. It's got my contact details on there. So you as a consultant or a nurse or whatever who sees that letter will then be aware that this practice is offering this service. When that letter comes back into the practice, and it's got something like child protection, for instance, we specifically say that letter mustn't be scanned into the medical record. Now therein lies a problem, because if it's not scanned in, well, where is it? And the truth is, it's in a pile somewhere in the practice. It's no longer available for anyone because we've been paperless for the last year and a half. So as a practice, doctors, nurses, allied health professionals, we only use the computer system. We don't go to the Lloyd Georges, we don't go to the paper records anymore. So that pile of paper is basically sitting there, not accessible by anybody. The only thing that we have in the medical record is a message in the active problem section that says on child protection register. That should hopefully flag up that there's a letter available for us to see.
So there's no way of hiding it, so that only you can access it?
Not at the moment. The technology is not there within the clinical system.
Which is a potential problem.
It is a potential. It is a potential problem, and then that's exactly why we've got the local care record law, because I flagged this up and I said, is it safer for us to have the letters available so everybody can see it, including the patient, or do we have it where it's not scanned and therefore not available for anybody to see? As things are at the moment, it's not scanned. And that was agreed by the local care record law.
It's probably worth adding that part of the NHS plan, which I think Alan was alluding to, the big picture is to create something called sealed envelopes, which don't exist at the moment, but in theory, the concept is that a clinician might decide that there's information which needs to be put on the electronic record but is locked away. But also the concept allows patients also to take parts of their record and keep them sealed. I think the other thing that's probably worth pointing out is Alan was talking about the LMC view around making sure that consent to accessing the records was explicit, and I'm sure, I think Yvonne could probably tell us if people would like to hear about the process that's been followed through in the MIS practice, where patients are taken through a very clear process to make sure they fully understand what they're signing up to. Because if you want to view your record over the internet, it would then be up to you as an individual how much you then share with a spouse, with your children, with parents. But the process is very explicit. So I think it's just worth making sure people do understand that.